All right, joining me now is February Emmanuel, who's spokesperson for aggrieved nurses at the Accra Psychiatric Hospital, and also Douglas Edufoko is a representative and also one of the spokespersons of the Coalition of Unpaid Nurses and Midwives, Ghana. Good morning, gentlemen. Thank you for coming.
Good morning. Good morning.
All right. Do you know yourselves beyond my introduction? You're both nurses.
Yeah, I think we almost work closer to, but not the same facility.
Okay. Let's start with your issues. You work with the Accra Psychiatric Hospital. Yes. Why are you embarking on a sit-down strike?
Actually, what happened is we, as nurses, we know how essential our work is and how demanding our work is. It has never been our intention of going on strike. That one should be out there to the public. That's never been our intention to go on strike. But what happened was, back in the days, if you're employed by government, when you, no matter the number of months or years that you've worked for, when your first salary comes, it comes with all the months and years that you've worked for. So let's say if you work for, say, a year or two, when you're getting your first salary, they pay everything in full. That was if you had some names like back pay. That was what we're trying to talk about.
And you guys seem to love it because even though it's delayed, it comes in bulk.
That is exactly so. Exactly so. But now, quite recently, I think somewhere back 2013, November, the government came out with a policy that they've realized a lot of inefficiencies in the system. So now they want to correct those inefficiencies. So thereby they introduced what we call the 3 months policy. And the 3 month policy means if you work for more than a month, more than 3 months or more than a year or so, they'll pay you just 3 months. And afterwards, you go on to fill a form. Actually, when it comes to Accra Psychiatric Hospital, for instance, we have 4 badges involved. We have those who are employed in September, and those September 2013, and some to us who are employed in June 2013. We have others who are employed in April 2014 and May 2014. For those who are employed in June 2013 and September 2013, our issue was we shouldn't have been affected by a policy that was introduced in November 2013, because we know that the law shouldn't take retrospective effect. But hey, this is the government telling you that this is what I want to do. So we never complained about it. We still went ahead and filled the forms that I was talking about. After the 3 months, they're going to pay you. We went ahead and we filled it, expecting that the money will come. We waited for so long, nothing came out of it. And we, as I said initially, that we, knowing how demanding our work is and how essential it is, we didn't want to do anything that would affect our innocent patients. So we went ahead and wrote a letter that's complaints to National Labour Commission to look into these issues. National Labour Commission, as I told you, they wrote a lot of letters to the Minister of Health for them to come, so the issue will be settled once and for all. They never came. If my memory serves me right, almost about 3-4 letters to the Minister of Health, they never came. So a sense of even subpoena them for the first time, they didn't respond. They wrote a second subpoena. Minister of Health never came. Yes, so we were not bothered. We still went ahead. And Honorable Haruna Idusu, the Minister for Labour and Employment Relations, came in and listened to us and realized that we have a point. So he also took a letter, then he wrote to the Minister of Health on 4th September 2014 that they should look into our matters to avoid any issue that is about strike or whatever. This letter that I have here, 4th September 2014, was never responded to. We were not bothered as well. We still went to GRNA, that is the Ghana Registered Nurses Association, to also look into it. The president wrote a letter to them quite recently. This is dated 10th June 2015. Today, as we speak, is 3rd August. Minister of Health never responded to this letter. So we realize that it's as if they don't care what is happening. And for us too, we are psychologically tortured. And these are patients that we are dealing with them mentally. They have difficulty. So if we, the nurses, if we are not sound, how do we take care of them?
Okay, so let's go back a bit. So you haven't been paid since 2013?
No, what happened was, as I said,
but you started?
Yeah, when we started September.
Okay, so you started September 2013.
Exactly.
So ideally, you should get September, October, November, first 3 months.
First 3 months.
Okay.
But it never came. We have to work up to somewhere July 2014 before the salary came.
Okay, so but did it come in bulk? Did it cover September to July?
No, they paid just 3 months.
They paid just the 3 months?
Yes. So they paid May, April, June 2014. So they left from 2013 coming on. Those ones never came.
Okay. Hang on a bit for me, because there's somebody in charge of your hospital in particular. Douglas, I'll come to you. Let me speak to Dr. Akwesi, who's the chief psychiatrist in charge of the Accra Psychiatric Hospital. Good morning, Doc. Thank you so much for joining us.
Hello, good morning. How are you?
I'm very well, thank you. I hope you're well too.
I'm doing great, thank you.
Cool. So your nurses are unhappy. They haven't been paid for such a long time. And they are embarking on a sit-down strike. How worrying is that to the hospital?
It's definitely worrying. It's definitely worrying. I mean, nurses are the main, they are the bulk. They are the backbone of any healthcare, and particularly in our situation. So obviously, if there is a grievance on their part and they are withdrawing their services, that is certainly worried. But at the same time, too, just as they've told you, they have a point of some sort, except that it is really not something that is just in their case. It's like it's been a chronic situation where people work for some time. It takes a little time before they are working. They are paid. The only difference in this case is the fact that when they are going to be paid, they will not be paid the full the salary that they would have earned all along. They would only be paid for just 3 months arrears, and thereafter they will not be paid, which is obviously unfair. But that has come to be a government policy of late. But the last time that we talked this over, what the government said, the minister said, was that it is not like a blanket statement that nobody whatsoever will be paid more than 3 months arrears, but you need to justify why you'll be paid. So you'll be given some forms to fill, and once the forms are filled, then you go through. Their predecessors, I think some of them are in that group, filled the forms anyway, but as it were, they still could not get the arrears. So basically that is the issue.
Okay.
We are trying to meet with the leadership and mediate between them and the ministry so that the impasse will be resolved.
So when was the last time, because you mentioned about the last time that you spoke on this matter with the employers, when was this?
This has been a frustrating situation. In fact, for about the last 1 year, they threatened to embark on strike for this reason. We mediate, we go to the ministry, and they've even we've gone to the Minister of Finance on this issue before. So it's like, it's not a new phenomenon as that, but that is not to justify, or that's not to say that they don't have any case. They have. But what I mean is that it's been something you've been trying to see how it can be resolved. And
Dr. Akwesi, your institution is a really, really important one. Why are they not listening to you? I mean, this is something that can be solved.
Well, I suppose I'm certainly not defending anybody, but I suppose it might be said that we are not the only people, the only institution in that situation. But
even so, it's not right.
Well, it's not a question of right or wrong. It's a question of, in our case, what can we do? What can we do? We fully sympathize with the nurses. I've just said that, I mean, if you work for so long and you're not getting your salary, it's certainly bad. But even if you get it and you are sure that you'll get all your arrears, at least even if you're going to borrow, then you know that at least I'll get my arrears to pay back. But if you are going to be paid and you'll be paid only 3 months, then what about all the rest of the time that you would have worked? Obviously, we sympathize with them. But it's a situation where it looks like we've been trying to do the best we can, and it's not easy. But as I say, you've given up. They are still trying to see how we can mediate and get
But from what I hear, you've intervened in the past. It hasn't yielded any positive results. So what do you intend doing now? Now that they've decided that effective today, they would come to work, but they won't work.
We will meet with the leadership and see how best we can do. We might need to move with them to the ministry, at least not all of them, a delegation or their leadership, and see what best can be done. We certainly will not abandon them. But I'm also...
But what makes you so sure that they will listen to you now?
You can only be sure or not be sure after you've tried. But you can't throw your hand in the air and say you won't try. So you'll try to see how best. Our plea would be that they've managed to contain the situation up to now. Could we probably contain it for the next 1 or 2 days and see what will happen?
Dr. Akwesi said things are hard. Things are hard. I mean, I can't even imagine not being paid for a month.
It is. I perfectly agree with you, but that's it. Well,
so what are you going to do today, really? How are you going to manage it with the hospital?
We will meet with the leadership and see what we can do. We will try and put emergency. After we've talked to them and seen the line of action, and you know this is being compounded by even the doctor's strike. You recognize that aspect or two? So we are in a really, really difficult situation. But again, as leadership, you will meet with them, see the best that we can do in terms of compromise here and there, and in terms of pooling resources, staff, to some emergency places and ensuring that we cut down the workload, the OPD, so that we can eliminate the challenges, the difficulties, but at least we can reduce the challenges to the barest minimum. But we will certainly engage with them and see how we can make it.
Is your OPD open?
Yes, it is. It is. But what we've done is that in terms of the doctors, we have a physician assistants and the doctors themselves. It's the doctors who have embarked on the strike, but the physician assistants are there. So what we've done is to redistribute the physician assistants. We had night coverage. Now you have to stop the night and pull all the physicians to the day and redistribute, make sure that we cover the OPD. And as much as possible, if it's not that urgent, then we reschedule the appointment. I mean, the patient.
So is this measure because of the doctor strike, you know, the earlier strike called by the doctors?
Yeah, this one because of the doctor strike. And now it's going to be compounded by the nurses strike. So we will see how we can adjust the situation.
How many nurses do you have ideally?
At the OPD?
The entire facility?
Well, we have about 450 nurses.
450?
The strike is not limited to the OPD nurses alone.
Yes, I'm asking about the entire nurses within the facility.
It's about 450. But it's not all the 450 who are involved, who are affected in this situation.
Okay.
That comes to about 70 nurses or so who are in this particular situation. I mean, as he said, these are nurses who started working from 2013. And some other nurses have been there for some 20, 30 years. So it's not all the nurses who are affected by the current crisis.
All right. Dr. Akwesi say, I don't know how you're going to handle this, but I wish you the very best.
Thank you very much. It's not easy, but we'll try.
Thank you for speaking to us. That's the man in charge of the Accra Psychiatric Hospital, also the chief psychiatrist. And his nurses are embarking on a sit-down strike. You hear the details as given by Emmanuel here. Emmanuel, I'll come back to you, but let me go to Douglas. Douglas, why are you also on strike? Are you on strike, or you are saying that if they don't pay you within a certain time, you go on strike?
Our release is about if they don't pay us our salaries and then our arrears. And also, secondly, post our junior colleagues, our junior nurse midwives, by 23rd of August 2015. We'll take action that might hinder the quality healthcare.
Okay,
in this
so
country.
these are three things you're asking for.
Exactly.
Let's go back to the first one.
The first one, if you can remember, last year, Wednesday to be precise, that was 29th October 2014. We released a press. After the press, the authorities called us.
You released a press statement?
Exactly. We released a press statement. And then we asked the government to pay our salaries with all outstanding arrears. By then, there was
Which
a directive.
is how long?
I
mean, what they owe you?
It differs because some of us, the coalition, some of us started work 2013.
Okay.
Others started 2014. And then currently, we have 2015 nurses on board. So we released the press to them, and then after the press statements, they called us to the Ministry of Health, which we discussed. And then they agreed to pay us our salaries and also work on the outstanding arrears. And then they asked us to fill the arrears forms, of which all members of coalition unpaid nurses and midwives so far have submitted. And then they also told us that they are going to put in measures, they are going to implement measures to curb the situation from reoccurring, because it's like every year the same similar situation occurs. So in order to prevent the occurrence of it, they decided to just implement some measures. And to date, as I'm telling you, my sister, our junior colleagues who were posted recently in 2015 are still facing the same challenges. And then those of us who were paid only 3 months, the rest of the arrears haven't been paid yet.
So how much, you Douglas, how much are you owed in terms of the months? How many months?
My sister, I wouldn't talk about my issue alone. I know the government is owing me.
No, I get it, but we need to appreciate
the problem
as well.
The government is owing me
arrears. Is it a year? Is it 6 months? Is it 3 months?
I can't make it public, but the government is owing me arrears.
That's not fair. So we need to appreciate the problems.
The government is owing me arrears. So
which you don't want to say.
Which I don't want to say.
Then why are you on strike? I mean, because government is not the only agent that owes. I owe. I'm sure you owe somebody.
Exactly. That's what I said.
So if we can understand, they probably owe you 1 month and they are working on it. So exactly. Why are you on strike? How do we appreciate the fact that you're on strike?
That's why I quoted that we have categories. Some started to work 2013. They've been paid only 3 months. The rest of the arrears haven't been paid yet. Others too haven't received anything at all. They haven't received anything, especially when you go to Upper West region and the likes.
So how many of you are we talking about here?
3,000 to 5,000. 3,000 to 5,000. The authorities
and you're saying that some have only been paid 3 months in 2013.
Exactly. And the rest of the arrears haven't been paid as we speak now.
But before that, what was the normal arrangement? How were they paying you?
Actually, I didn't want to repeat because February also said
so
the same
it's
thing.
The same.
Exactly. It's the same procedure.
So usually you'd work for about a year or two and then they will back pay all of it.
Exactly. And then everything. But we should remember, before we started work, when we started work, and then the arrears were not coming, the salary were not coming. The salaries were not coming. We went for loans, okay? And then to date, our loan agencies are chasing us. We thought, we had it in mind that definitely the arrears will be paid for us to settle those loans we went in for. And how can a nurse, just be honest, how can a health worker, a nurse, a midwife, be smiling with the patients and then their relatives when such a nurse or a midwife is traumatized due to the harassment and then the threats that loan agencies are giving to them that they are going to arrest them if they don't refund those monies.
So what are you saying? Are you on strike?
We are not on strike yet. We are just giving it like the public a notice and then the government. That's why it came to you, because you, the media, when you speak, the government really
But is that supposed to be the norm? I mean, don't you have processes that you have to go through?
We do have.
There's the National Labour Commission.
Honestly, my sister, we've gone through all the processes to the extent that we met our GRNA president and then other executives last year. Last year, my sister. And it's
so
very
do you have documents? Because Emmanuel has got documents of conversations between the Labour Commission, the Ministry of Health, which in this case, I mean, they employed you. The Ministry, the Ghana, and then there's also the Ghana Health Service, and then the Ministry of Health. Have you gone? Do you have documents to show communications that you've had?
We have documents.
But what have they said to you?
Nothing positive. The last time we went to the GRNA quarters, our president, our national president, even asked us to see the Human Resource Director of Ministry of Health. We met the man, and the man every day is like the usual reassurances. They reassure us, and then they fail to promise. Honestly, it has pushed us, that forced some of us to even mistrust the politicians. In quotes.
Emmanuel, don't you think, you health workers are becoming too much? And if I say you health workers, I'm boxing all of you up because the doctors are also on strike. I mean, they don't even call it strike. They say they're going to resign. This is just the beginning of something bigger to come. Then suddenly all of you are waking up. I mean, psychiatric nurses, midwives, and coalition of nurses, all of you coming up at the same time. How do you want us as Ghanaians to view you?
You see, that's how come I gave a little history about how this whole thing started. Back in the days, it wasn't happening so. When we start working, everything is paid. But what happened, that 2013 coming on, was they introduced a 3-month policy. And even with that, with all the things that we're talking about, we felt it and we complained. So it's not like we health workers are becoming too much for the public. That's not what we want. If you're looking at what we want to do right now, it's not like we just want to lay down our tools or go off. We said we are going there, but you can see my uniform.
Yeah, but if you go there and you're not working, I mean, what's your use there?
It tells you that when they pay me, I'll just go straight to the ward. Because if I don't care about those innocent patients there, I would have just gone off. But that's not what we want. So it's not we're becoming too much. We also have our parents who are on retirement and we need to take care of them. We have people, nursing mothers, who need to take care of their children coming up. What do they want the children to tell them? Because always you come out, you come to the house and you do tell them there's no money. You know, they see you going to work. So it's not we're becoming too much. No. Do we want us to go there when we are psychologically traumatized to go and have that effect on the innocent patient? That's not what we want to do. So that's not what we want the public to see us. We're ready to work. We know we are essential workers, ready to work. But what comes to you being an essential worker? It means your salary, what you do, you must be paid. As simple as that. If you are paid, then also go ahead and work.
So in the meantime, I mean, you guys haven't been paid for such a long time, even though Douglas would not say personally how many months, but how have you been surviving, Douglas?
That's why initially I stated that me personally...
I want your personal story.
Yeah, my personal story. I went for a loan. I went for a loan. And until date, I haven't been able to refund it. It's very terrible for me. And then let's clarify this thing. It's not like we health workers, especially nurses and midwives, love going on strike or taking actions that may hinder effective healthcare in this country. We love our patients. We love our patients' relatives. We have the passion. Our nursing job is a core, it's a passion. So sometimes even if like government policies and directives force us to take measures that affect the healthcare in this country, we go to our rooms and we cry deep inside our hearts because our relatives also go to the hospitals. Our friends, our wives, our girlfriends, they all go to the hospitals. And if they go and then we are taking actions and then we are not at the hospitals, does it affect us all? It does, my sister. So we are just pleading, at least. We are pleading. The patients, the relatives, the journalists, all the media, they should make sure they intervene for our salaries and then arrears due us to be paid. And then to add, with regards to the unposted nurses and midwives, the nurse to patient ratio in Ghana here is very low. We have one nurse taking care of about 20 to 25 nurses. Instead of the per who, that has to be one nurse against 3 or 4 patients. You know, when you have one nurse taking care of 3 to 4 patients, it's very effective. The quality care is being ensured.
Sure.
Unlike one nurse or one midwife taking care of 20 to 25 patients.
Let me speak to one man who's been negotiating on your behalf. Let's see where things have gone wrong. I've got Kweku Asante-Krobia, who is the president of the Ghana Registered Nurses Association, joining me on the phone lines now. Mr. Asante-Krobia, good morning to you. Thank you for your time.
Good morning.
So your nurses are threatening to go on strike. Is it that negotiations with the employers have not yielded any positive results? What seemed to be the matter?
It is exactly the case that the negotiations have not yielded any fruitful results, at least to their satisfaction and pleasure, and that is why they are threatening to do this.
Is it the same issue of the back pay, the bulk back pay has not been paid, or the 3 months has also not been followed through? I mean, is that all it is to this matter?
Well, it's 2 issues and 2 groups of people. One group is about 200 psychiatric nurses who have had issues with the government and the employer. They have some of them work between the months of between 11 and 15 months before they had their first pay. And when the issue about the payment of the backlog was discussed, it became an issue because when they received the first pay packet after working for 15 months, only 3 months was paid then. And in fact, since then they've been receiving their monthly salaries, but they have negotiated for the payment of the arrears, and the government has not been forthcoming with any positive result. We have had a series of discussions with them, and the case went to Labour Commission to pin the Ministry of Health, the employer, and they refused to honor their invitation. And so Labour Commission asked them to write at the back of the Amanda Association, that's the GRNA, for the negotiation. And so when we sat down to discuss it, that they threatened to go on strike, we restrained them because we said we're going to take up the matter. We did take up the matter. I wrote to the Ministry of Health meeting. In fact, this one, I was virtually pleading with the Ministry of Health that a thing like this could come about, so they should help us get the Ministry of Finance, get a financial clearance for them. But they did not give any positive response to our request. In fact, there was a time that they gave the GRNA, that the psychiatric nurses gave the GRNA three weeks to get their pay for their back pay for them. And that one became a problem because I knew that the decision didn't lie at the court of the GRNA, neither the Ministry of Health, because these 2 parts, that the GRNA and the Ministry of Health, were going to request the Ministry of Finance to get the financial clearance.
So is it a matter of the association not being effective, or the National Labour Commission not being able to bite, like they say?
The association, I can tell you, is very effective. But if government becomes recalcitrant, or the Ministry of Health becomes recalcitrant, there is nothing we can do.
But you've got the National Labour Commission.
Yeah, the psychiatric nurses went to the National Labour Commission and they took up the matter. They ruled that the psychiatric nurses had a case, and therefore it was the prerogative of the the professional association and the DRNA to lead them to get the money. And they also got the Ministry of Health to say that they must ensure that these nurses got their pay. And as I have told you, the professional association doesn't have the strength or the power to get the money for them.
So this is simply a matter of the Ministry of Finance not paying, even though from all indications they are supposed to.
Yeah, from all indications they are supposed to pay, and they know that very well. In fact, let me say that all these things that we are doing, the doctor's issue, nurses issue, and the pharmacist issue, the Ministry of Health doesn't have the solution, and somebody has to get this right. It is about financial clearance from the Ministry of Finance. And if the minister then says he is not going to pay, there's nothing anybody can do.
Is that what he said? Is that what he has said?
Well, that is the situation, and we have to understand it like that, because it is not the Ministry of Health, even though the Ministry of Health hires, it is the Ministry of Finance that pays.
You know, recently we've heard about documentations not being okay. So perhaps it's a matter of your documents not being up to date. That's why the Ministry of Health or the Ministry of Finance will not agree to pay.
In the case of the psychiatric nurses, there's no problem with documentation. And I think when you were speaking to the group leader, these things were made clear. And you also heard about the 91 doctors, the issue about the 91 doctors.
Exactly, the junior doctors.
The issue, that clarifying the issue, that documentation was not a problem. So I don't want anybody to blame the issue on documentation. Right. So we need to understand the issue.
So how do we go forward? How do we go forward from here? Because in the end, I mean, it's not the big people who are refusing not to pay who would suffer. It's us, ordinary Ghanaians.
We are going to go forward, letting the government know that it has to instruct the Ministry of Finance to issue the financial clearance for the payment of these debts. That is the issue, and that is the way to go.
Is there a certain deadline that you're trying to hold so that we can also follow duly and see what happens by that deadline? Well,
I must regret to say that the situation is almost getting out of the hands of the DRNA, because we have done our best, our very best. And I can tell you for sure that the Ministry of Finance knows that what that ministry is doing is not right. Right? Because you see, when I feel saddened when somebody says that we have to negotiate. Negotiate for what? Right? You see, now, issue about condition of service is pending. That is what somebody can tell me, and I will understand that it is a matter of negotiation, because it is collective agreement, and so if the framework is done, you have to negotiate. Obviously, it is not about payment to workers who have worked for the nation and they have to get their pay. You don't tell me that is negotiation. There is nothing negotiable about it. It is not negotiable, right? Pay them because they have worked and they have to take their salary. And I don't see how anybody to create a problem in this situation. It is not about negotiation.
Sure. Finally, is the employer, you know, if the employer says, for instance, that whilst they are on strike, he's going to take those days out of the salaries for the month of August, for instance, would anybody, you know, blame them for that?
Well, that would be very unfair. A typical issue of unfair labor practice.
But if you don't work, you don't expect to be paid.
But if I work, don't I have to get paid? My sister, if I work, don't I have to get paid? See,
yes,
who is going wrong here.
But this is a matter of, because you have not been paid, you've decided not to work any longer.
Right. Well, if you sack me, then you have done that wrongly, and you will have to also pay a compensation for that.
But is this strike legal? Is the strike legal?
Well, it is yes or no. If it is illegal, then it means it is the government that has made it illegal. And if it is if it is legal, then it means that it is the payment issue that has brought that about, and I will.
That sounds very confusing to me.
What? Well, I'm answering your question. That it could be legal, it could be illegal, and legal in the sense that I have worked, you are refusing to pay me, and it is my right to restore to such an action and give you the pressurize you to get me my salary, and then there is nothing like you sacking me because I'm asking for something that is my rightful position.
Okay.
And illegal perhaps in the sense that you want to shortchange me by trying to be overbearing on our relationship dealing, and that is what I call unfair labor practice on the part of the government or the employer.
I know I did say finally, but are you in on the strike as well, personally?
Well, you see, strike about labor union is usually declared by the leadership. And I can tell you, the leadership of the Ghana Registered Nurses Association has not declared any strike action for nurses, right? That I must say clear. It is a cohort of nurses belonging to the association who want to embark on this strike action, and that is a very significant percentage of the membership of the association that wants to do this because they are aggrieved.
But is that right? I mean, a group within the association.
Yeah, it is. It is. Of course, they are nurses, practicing nurses of good standing to the Ghana Registered Nurses Association. And I think that because they are members of the association of good standing, we need to pick up their issue.
So is it to say then that you're backing them on this action that they're
we back them, but I'm not taking the generality of nurses in this country for strike action. We are not. We haven't declared any strike action.
Okay.
But we are backing them to get what is rightful there.
All right.
And somebody has to listen to them.
Okay. Well, we'll have to leave it here. Hopefully, by close of day today, somebody would indeed listen to them. Thank you so much for your time. That's Kweku Asante Krobia, who's the president of the Ghana Registered Nurses Association. I've still got two nurses here with me, one from the psychiatric hospital, who are embarking on a sit-down strike today. So they effectively are on strike. The other from that coalition within this bigger group of the Ghana Registered Nurses Association, who are given some deadline of, is it 24th of August?
Yes, we gave the government up to 23rd
of August.
And then 24th of August, we'll take action.
So what action are we talking about?
You get to know when the time gets there.
Oh, like seriously?
Yeah, exactly. Because
I mean, you're saying that if they don't pay you by the 23rd, you're going to do.
The reason why
so tell us what it is that you want to do.
We take action. We don't want it to. We want to surprise the nation. That's why we said we don't want to take action that will hinder.
You want to surprise the nation.
Exactly.
Oh wow. You want to surprise the people who employed you, or you want to surprise the nation?
The reason why I'm using the nation is you are a potential patient, right? You're a stakeholder.
You are too.
Exactly. So I'm involving everyone. That's why we are calling all the voices.
But what have we done?
You are in Ghana here. Definitely, if you put your mouth in an issue or you say something, you definitely can put pressure. You are using right now. You're using your platform to give us the opportunity to deliver our grievances to the public.
So tell us what you intend to do after that 23rd. If nothing happens.
If nothing happens,
you're going to go on strike. You're going to sit down and say you won't work. You'll go to work and not work.
Not just strike.
You
That's why I said not just strike, my dear. Not just strike.
But what?
You get to know.
Something legal?
When it gets there, we'll know, my sister.
Amazing. So, what do you think the way forward is, Emmanuel?
He even mentioned that at, let me say, the general site, a nurse to 4 patients can even manage. But I can tell at our end, there's no way one nurse can take care of 4 psychiatric patients. What happens is when even the police, they come with them in handcuff. And we've never seen one policeman come with a patient before. There are 2, 3, even in handcuff. When they get there, they just release them and they give them to us. And we do manage them. And there's nothing like risk allowance or whatever. As I sit here, I've been served by a patient before. Nobody paid me a penny. This is my salary I'm talking about. I've worked for. Pay me, let me take care of myself. The government refusing to. So it's not like I say we don't care about patients. But what happened at psychiatric hospital? It's an eyesore. I wish the general public can just come in one day and see what we go through.
So now that you're not working, can you, because I'm sure people can begin to imagine what's going to happen. Do you care about that?
Yeah, we care. That's the kind of answer. We are starting with the sit-down strike. At least for somebody to listen. We are starting from today to Friday. How many days? We started last week. We issued a statement last week, Thursday. So coming Friday will be more than a week.
So if nothing happens on Friday, then what?
We have no option. We just have to go to the house. So at least the people who come to us for the money and everything will get to know that, yes, indeed, just have been telling that we are working, we are not being paid. It's true. It's not like we are lying to them. So we're in the house with them, they understand that it's true that we are not being paid. So
if nothing happens to your situation, you're saying that after Friday is total withdrawal?
That is it. That is it. It means the government is ready to listen because we've done all that. These are the documents here from Honorable Dusu, from GRNA, from Labour Commission. What does he want us to do? We've gone through all the process. Legally, everything is there for us to show to the world. So if the government really cares about these innocent patients, we care about them so much because these are people who have been neglected in the society. Stigma is everywhere. You know, when now somebody's suffering from mental illness, it seems like the world is against you. That's not so. They also have hope, and we have things that we can do for them to get well, to come back. So the government should listen to us and pay us our money. That's what we are trying to tell the government. Well,
we'll have to end the conversation here, but I've got some persons commenting on the issue on Facebook. Got to share this one from Commissioner Gideon. Says the issue of 3 months pay arrears, government workers, and I think government is lawless about this. Okay, Abanga John says the fetish priest that predicts the doom of his country does not escape the doom. All right, so if you've got comments on this issue, you can also go to facebook.com/Joy News on TV. But my guest this morning, even though it's not, it's not nice, the action that you're seeking to take is not nice. I should also say that what is happening to them is also not good, because I cannot imagine, and none of us here with this company that we work with, salary delays for a day or 2 or 3, people will personally call the CEO and ask why the salaries have delayed. So you can imagine if it's 3 or 11 months, that's a lot of months to be owed. But February Emmanuel, spokesperson for aggrieved nurses at the Accra Psychiatric Hospital, and Douglas Edufoko, who is one of the spokespersons for the Coalition of Unpaid Nurses and Midwives Ghana. We thank you for being here, for sharing your situation with us. Hopefully your voices on air would get the authorities to pay attention to you.
Thank you very much, and we are hoping that by Friday the government should pay us every penny that we have. We are ready to work, and we care about our patients a lot.
Are you also ready to resign?
When we get there, we'll know.
Amazing. Thank you for it.